Hey guys, you're watching the Best Practices Show where we take a look at the best business practices from the best dental practices all over the country. Crazy special edition this week. We are out at the Seattle Study Club Symposium 25th Anniversary Legacy Tour here in Palm Springs, California. And if you're not here, my first question is why not? This is amazing. The best influencers in the world in dental education. And today is no exception. I've got a good friend of mine and you're going to see why here in a second. So do me a favor. Hit the share button. We'll see you in a few seconds. Hey guys, welcome back to the Best Practice Show. Thank you so much for watching. And again, this is just a crazy special week for us. We are out at the Seattle Study Club Symposium in Palm Springs, California at the La Quinta with some of the best dentists in the world and great education. And it is an incredible week. We get to see our friends and our colleagues, our mentors, and get exposed to a lot of information that really gets you to think, right?
Right.
Yeah.
And warm sunshine.
And warm sunshine, which is also a great thing. And so today I got one of my good friends and fellow speakers who I get to see on the road all the time, who is a huge influencer and one of the hottest topics in the world right now in the field of dentistry, Dr. Steve Carstensen, and who's a member of Pankey, also an educator at Spear. And so if people don't know you, because we have a lot of young students that are watching, who are you? And just tell us a little bit about your background and what you do.
Sure, I'm a restorative dentist for all these years, but over about 20 years ago, I started paying attention to airway issues, and I had some mentors who said, man, you got to do this, and so I started helping people breathe better at nighttime, using my appliances, things that dentists can do, and that turned into so many great rewards. People were coming back saying, wow, thank you for this, and I started educating about this, and as an educator for a long time, like we do, then I said, well, I could do this because I have this Pankey background, I have Pride background, and I could bring those two skills and help dentists identify in their practice who they should talk to about airway issues. And then what they can do about it. And I started that a long time ago as well. And so now that's kind of all what I do full time. I see patients, I write about it, and I teach about it.
Now this is such a hot topic, as all of the educators, even the orthodontists that are presenting this week, there's a consistent theme. It's pretty exciting to watch all the specialties. Now everybody's on board, and as we've talked before, all the dots are starting to connect, So I think, and so why, because you've been watching this evolve why is it so hot as a topic right now in dentistry when you look at the big picture?
Well, one of the things is we've had a lot of unexplained things in dentistry. Things like jaw joint issues or tooth wear or grinding, or patients that are coming in saying, well, I just don't feel right. And as dentists, we've been thinking about the dental stuff, the tooth issues, and we've had all this work on TMD issues. What can we do about it? And the field of medicine and the field of dentistry is changing from a repair or what's wrong status to a how did it get that way status. So we start looking back in medical time, as it were, in that patient's history and saying, well, how did you get this way? What caused those teeth to be worn down? What's the source of the jaw joint pain that you're having? Why are you having headaches? And as we look back in medical time, we'll see that focuses on airway issues. Because it's the physiology, the homeostasis, the way the body's managing, that's causing the response that the dentists see in the worn teeth, for example. Or the patients are complaining about sleep issues to their dentist because they're hearing about it in the news. It's all over the news nowadays. You can't escape an article about sleep issues. And many of them are mentioning that there's a different choice of therapy between the CPAP, which is traditional, and new therapies like surgeries or oral appliances or some other thing that they can do. And so they're bringing it up to dentists. And then dentists are always interested in finding new things to do. And so it's a new service mix, and that's kind of exciting. We've been through many of those kind of cycles in dentistry as we've gone forward. And so now it's one of those, but it happens to be one that also has huge implications for the physiology and the health of our communities.
Right.
So different than bonding or different than Invisalign, which are great things to do, But health, community health, not so much.
Yeah.
Here we get a chance to be part of the improvement
Yeah.
in how everybody feels.
Yeah. And I have a million questions for you on this whole thing because it's such a hot topic, but I want to break it up into kind of three pieces. Number one is the chronic aspect of it.
Yeah.
Talk about children, because as you and I talked before, this is a huge problem. We know children have some of these airway issues, but oftentimes the default is it's an ADHD issue and these kids are being prescribed medication when the kid can't breathe.
Right.
And then the third aspect is, if you're a young dentist watching this, my question, I've asked you this question all the time, how the heck would I monetize this or even start?
Sure.
So can you help us unravel those? So let's start with the first one, the chronic implications,
Well, there's a physician in Stony Brook,
Okay.
Dr. Gray, who came up with some ideas some research
Right.
that shows, well, okay, what's going on here? And it turns out that this is fascinating. We breathe through our nose, cranial nerve 1. Cranial nerve 1 has little receptors on it that tell us what we're breathing, whether it's a rose or whether it's something bad. Turns out it also has baroreceptors on cranial nerve 1. That's why when we sniff, we go through that little reflex. We don't know that we're going to do that, but that's how we gather in more data.
Right.
So that mechanism's there, those baroreceptors. Those baroreceptors go right to the limbic system. Now the limbic system's in the middle of our brain. It tells us how we should respond to outside things, emotions. It also has a big connection with the autonomic nervous system.
Okay.
So now we have these pressure changes in the nose, sending signals directly to the autonomic nervous system. If we change that enough more frequently, then the body adapts to those changes.
Right.
When it adapts, it upregulates the sympathetic nervous system, the thing that makes us nervous, the things that fight or flight, all that kind of thing.
Right.
Now, pain perception is changed when the sympathetic nervous system goes up. So there's patients in chronic pain, say fibromyalgia or TMJ issues, what the Dr. Gold and others called unexplained medical conditions.
Right.
Now he calls it the functional somatic pain syndromes. So as dentists, we're seeing patients who can't sit still in our chairs, who complain about tooth grinding, about chronic headaches, who tell us histories of fibromyalgia. And what we can ask them about is, instead of saying, well, what medications are you on? Or can I make you a bite splint? Or some of the things, these are not bad therapies, but they're again aimed at symptoms. We can say, how do you sleep at nighttime?
Right.
Do you breathe well? And they'll go, why are you asking? And so we get to start a whole new conversation with our patients at a higher medical level.
Right.
And when we get a chance to do that, now we're getting at the etiologies of things.
Right.
And we become more important in their medical treatment than just the tooth fixtures.
Right, and this is just the tip of the iceberg too, because a lot of times we're looking at interruptions and all those other things that are, there are bigger implications to this, because when you're talking about this, you look at the cortisol levels, the body's experiencing extremely high levels of stress,
Right.
which has huge implications,
Cortisol is supposed to go way up in the morning. That gets us ready for our day. Then it goes down. And it responds on an interim basis if we need it.
Right.
Well, people with this functional somatic pain syndrome, the cortisol level doesn't go down. It stays up all day long. And that is not healthy for us.
Right.
We do this day after day, week after week, year after year.
Right.
And it's no wonder why we see people in middle age with these chronic pain problems.
Right.
Because they've had dealt with it for decades.
Now let me ask you a question. When I don't get any sleep, you know how you feel it. You can
Yeah.
feel it. You can feel it in your face. You can feel it in your chest. I didn't sleep very well last night.
That's right.
And this is not good. Like, it's not good. Is that part of what you're experiencing when all of those things come together?
It is, because, and I do a lot of reading on this, but Matthew Walker just wrote a book, and it's called Why We Sleep.
Okay.
It's scaring the Jesus out of me, because it talks about what happens when we don't get enough sleep or enough quality sleep.
Okay.
And it's you think about our physiology.
Right.
What do we need? We need to take in food and water.
Right.
We can live without food and water for a little while. We need to sleep, because if we don't sleep, our brain's not ready for the day, our body's not prepared.
Right.
And we need to breathe.
Yep.
And the fundamental nature of our brain stem, is to make us breathe.
Yeah.
It'll do anything it needs to make us breathe. So that's how critical it is.
Right.
So if we don't breathe, and it interrupts our sleep, now we've got two of the three basic fundamentals that are disrupted.
Okay.
That can't be good for physiology.
No, it's not. And let me. I just thought of this question too, as you're saying this. what about blue light and its ability to exacerbate this whole issue? Like, because now we can't live without our phones or our computers.
Yeah.
What's the research telling us and all that?
Oh, that's really clear because we go through it right now. We're both producing melatonin in our brains. That builds up a sleep drive.
Okay.
Makes us sleepy when it's time to go to bed. Mm-hmm. Well, blue light interrupts the production of that, and it actually works against it. And there's a sensor on our part of our brain that gets those kind of things and sends signals to the melatonin production center that says and it's really sensitive to blue light.
Okay.
Because that's what controls what's going on here.
Right.
You know, we're built with a diurnal mechanism. During the daytime we're awake, when at nighttime we're asleep. That's what humans do.
Right.
Well, as we are exposed to light, that light is what signals that. Mm-hmm. As it wanes through the daytime, melatonin goes up. We artificially interfere with that waning of the light, and now the melatonin doesn't go up, and we lay awake with insomnia or not being able to sleep.
Right.
So,
now that easily leads into the next question, which is, children.
Yeah.
I mean, give us some perspective of the landscape for children, because you can see these children, they're sleep deprived. You don't need to be a doctor to notice a 7 or 8 year old that's sleep deprived. I mean, the symptoms are clear, but what do we do? Where do we even start, and give us some perspective on that landscape?
Yeah, when we see those children with the droopy eyes, like you were indicating, or they're just not behaving well.
Right.
What's wrong with them? Mm-hmm. Well, because they're kids. They should be energetic. They should have plenty of energy. We're giving them good food, right? All those kind of things, right? So what's wrong with them? What's wrong with them is they're not getting good rest at nighttime.
Right.
And during the childhood, they should be sleeping 12 to 13 hours at nighttime.
Okay.
And if they're not getting 12 or 13 hours of restful, normal brain cycle sleep, then their brains they're rapidly developing at this stage, aren't going to develop in the right way.
Right.
They're going to develop on a wrong health trajectory. Mm-hmm. And then if we start to give them medications and things to change their daytime behavior, say they're sleepy, say they're not behaving well, those kind of things, well, what the physicians have to treat them with are amphetamines. It stimulates that kid to be able to do. When I was learning about these kind of things, I thought, amphetamines for kids that are hyperactive? What's wrong with that? And I was told it was a paradoxical response.
Right.
But in reality, what it is, it's waking up parts of the brain, deep parts of the brain, that are just not ready for the day because they weren't prepared at the nighttime. So what we do is we think, well, why isn't the kid sleeping well at nighttime? It could be environment. They could have family things they need to change.
Right.
But more likely, they're not breathing well at nighttime.
Yeah.
And the most likely reason they're not breathing is because they have a closed airway.
Right.
And there's two problems with that. One of them is big tonsils and adenoids.
Right.
And it all stems from not breathing through their nose.
Okay.
And mal-shaped jaw structure.
Right.
Because they don't breathe through their nose.
Right. Now, okay, expand on that too, because as we've watched some amazing orthodontists talk, the palate has changed.
Right.
And why is that? Why have palates changed of children? Their palates are different now than they were 100 years ago.
For two good reasons. One of them is we're a little less breastfeeding.
Okay.
Not everybody can breastfeed, but a lot of people choose not to.
Right.
And that just starts off a bad tongue position.
Right.
And so the child doesn't learn the right tongue position because there's no reason to.
Right.
Then the second part of early childhood is we're feeding kids soft foods.
Okay.
We evolutionarily we grew up eating hard foods, things we had to chew.
Okay.
Raw carrots instead of mashed up carrots.
Right.
Things that beef jerky is of all things, as opposed to beef puree.
Right.
And so the jaws have to develop, the tongue has to work, and it develops a position in the upper part of the mouth that shapes the maxilla, the upper jaw. Yeah. When a maxilla grows like a paper mache, it can be expanded, it can be contracted, and it can be expanded by the tongue being pushed up in the roof of the mouth.
Yeah.
It can be retracted when the mouth is open and the buccal tissues all squeeze it in.
Right.
And so getting a child to breathe through the nose all the time, 24/7. So parents can look for that. If the child is breathing through the mouth anytime, it's something to be worried about. Not when they have a cold, sure, but when they should be able to breathe through their nose and they don't, that creates a dirty, cold air going into the airway, which makes tonsils and adenoids worse, which crowds the airway, which makes them breathe through their mouth, and so it's a cycle.
Okay.
If we can help kids breathe through their nose by just simply habit developing, and help their jaws develop by getting the tongue in the roof of the mouth, and that means maybe sometimes a tongue tie release or harder foods or good habits that can be developed when they're 3 or 4 or 5 years old.
Yeah.
We have a whole different health trajectory we can send kids out on.
Yeah, well, and let me, I want to ask you the ultimate question that I consistently ask you all the time, every time I see you, is that if I'm a young dentist watching this, and you're a world-class educator, Steve, like, help me make sense of this. First of all, how would I even incorporate this into dentistry? Because I know it to be true. Right. Number two, how would I monetize this? And monetizing comes later, but like even start to communicate with patients. What do you tell young dentists when they come up to you and go, I know what you're saying is right, but where do I start? What would you say?
Well, it's really simple to find patients that are at risk.
Okay.
For adults, we have simple screeners. There's one called an Epworth Sleepiness Scale. There's one called a Stop Bang. I teach it wherever I go. Lots of us teach this everywhere we go. It's on the internet. It's easy to find. Those are simple screeners, and there's scales for that. How much are you at risk for having a breathing problem if you answer a certain way on these simple scales?
Right.
Now, the Stop Bang I really like because it also stimulates a conversation.
Right.
It's not just 4 questions. There's 8 questions. You have to measure next and weigh them. And so the patients are going to say, well, why are you doing this? And that's a great opportunity for the dentist to declare that they're interested in more than just tooth health.
Right, because this isn't going away.
It is. Oh, no. People are still getting older.
Right.
Yeah, we have more than 80% of the people that have a problem aren't diagnosed yet. We don't have enough sleep physicians to do the diagnosis, and even in adults, dentistry is going to be a big part of this because a ton of people can't use the mask. These are adults. These are non-growing patients. Yes, the orthodontists can do wonderful things now with expanding palates and other things, but our biggest opportunity and the thing that dentists have the most exciting thing to do with is kids. Yeah. Because it's, like you said earlier, it's simple to see a kid that's not breathing well.
Right.
We have screeners for them too. And we don't need a sleep test to know that jaw isn't developing right.
Right.
We can look in the back of the mouth and see tonsils. We can have them close their mouth and see how long they can breathe through their nose. And if they can't, we can give them water to drink. And if they can't drink water without breathing, opening their mouth is a problem. And dentists are the growth and development experts.
Right.
Our orthodontist colleagues are the specialists in this, but it's not just them, because even general dentists can get involved with some habit correctors, with some functional appliances, lots of things. So what can a young dentist do for this? Start to pay attention to the kids in their practice.
Right.
Think more about etiology versus just what's going on. Why did this happen? And then learn more about those kind of things. And then the young dentist can say, or any dentist actually, can say to the parents, tell me about your child's breathing.
Right.
Can say to the adults, tell me more about your snoring and sleep apnea. Tell me have you ever been diagnosed with this? Do you sleep well at nighttime? All those kind of simple questions. Then they have to know what to do next, though. Now, monetizing is not that difficult anymore.
Okay.
When I started a long time ago, the appliances had no coverage in anything. No dental coverage, no medical coverage. It became a medical issue, and so now it's all covered by medical insurance. And now there's a lot of companies out there that'll make it super easy for any office to do that. So that's really not a barrier anymore.
Yeah.
And the whole treatment cost is less than a couple of crowns in most offices. So we're not talking about, we have skills for helping patients choose something that's in their best interest, even if it costs them out of pocket.
Right.
So we have those skills. Let's use them for this other thing too.
Absolutely. And you and I go to all these meetings, all over, like great meetings like this, and it's so true. These sleep courses, they're full. I mean, it's a hot topic. So if you're a young dentist thinking, well, I can't find him, that's not true, I would say just look, because they're everywhere and they're full.
And there's a number of ways to learn about this. You can go to the conferences, like what I go to and talk for a day or a day and a half. That's fine. You can go to a little bit extended ones. I happen to teach one at Pankey, and we have extended courses at Spear. There's other places to go for that too. You can go to mini residencies. There's a few of those around now too, where you can go repeatedly over a course of several weekends and get a lot of experts in on these kind of things. And one of the cool parts about this for dentists is this is other than surgery maybe the closest we get to collaborating completely with medicine, because we're treating airway issues, yes, mechanically. But we're having medical benefits. And so our patients need medical supervision a little bit too, some primary care, those kind of things. So when we get a chance to learn the medical implications beyond just what the teeth look like because of a worn tooth.
Yeah.
Now it's so exciting.
It is,
you know,
very
because it's a big professional challenge. It is way outside of what we're trained in dental. Well, I was trained in dental school.
Yeah.
And I don't know what the young people are being trained at now, but they're busy working on teeth.
Right.
I get it. But here we get a chance to think about whole bodies, and that's pretty exciting.
Right. And I've asked everyone this, but can you remember a more exciting time in dentistry?
You know, there's so much we can do nowadays.
Yeah.
You know, not just in the restorative features, like what we're learning here, you know, all the beautiful restorative work that we can do, kind of more traditional dentistry, but at a super high level. Yeah, that's fun. But now we have a chance to involve ourselves with the whole of physiology.
Yeah.
With getting somebody to start off with as a 4-year-old and say, you're going to be a healthy 44-year-old and maybe a healthy 122-year-old. We don't know. You know, because we are able to see a better trajectory of health for them.
Yeah.
In fact, this summer I get a chance to put together a conference at ADA, and we're gonna help dentists learn how to treat these kids. We're going to bring in all the stakeholders. We're going to bring orthodontists and the pediatricians and pediatric dentists and ear, nose, and throat doctors and general dentists. And the American Dental Association wants to help us see how we can be an important part of that too.
That's great. And we need the help of all. Everybody, the way I look at it, is everybody's working together now for such an important issue.
So many times dentistry has been separated from medicine.
Yeah.
And dentistry sometimes separates itself from itself.
Right.
I mean, we have different factions and you know, worrisome things about dentistry.
Yeah.
Now that with this, not only do dentists have a chance to be the leaders in helping children develop a better airway, we can do it together as opposed to way apart.
Yeah.
And won't that be a better future for dentistry and medicine and these kids? Yeah. I'm so excited about that.
I am too, buddy. I'm so grateful. I have so many other questions. You do a lot of webinars. Now, I love your education, what you do. If people are watching this and they want to learn more about what you do a lot of instructional webinars. You're so good at presenting the information and teaching it so well. How can I find out more about you, what you do? Where can I find you?
Well, I have a magazine, Dental Sleep
Dental
Sleep Practice Magazine. So
Yes.
I like people to go to that.
Get a copy of it. So
DentalSleepPractice.com.
Okay.
You know, that's there. So I get a chance to gather in a lot of other people's good education. We have CE, and so it's a labor of love for me on that one. I love that part.
Right.
I teach through Seattle Sleep Education. So SeattleSleepEducation.com is my website. It's a pretty minimal website. It's not like yours, but it's fun.
Okay.
And I love to talk to study groups. I really like talking to small groups.
Yeah.
Because we get a chance to make effective changes.
Yeah.
So we do hands-on with appliances, all kinds of cool stuff, and then of course they can come to Pankey Institute. That's the best place to go, I think.
Absolutely.
For education.
Absolutely. So if you got a study club, this is the guy you need. So thank you, my friend. I really, really appreciate
This is
you.
a lot of fun.
Absolutely. And thank you guys for watching. If you have questions, continue to add them to the feed. We'll see if we can't get you a good answer to this. But again, being out here at Seattle Study Club, Symposium 25th anniversary, this is the cool stuff you get to see, be with these people, get to know them, hang out, and learn a ton. And by osmosis, I just get better. So it's good stuff.
You got a great job here.
I have the best job in the world. I told him I'm not even the smartest guy. I can just ask questions. And this stuff it's so good. So thank you so much for watching. If you enjoyed this today, which I know you did, do us a favor, hit the share button, share it with your friends, and we'll see you next time on the Best Practice Show. You guys keep watching.